If you've sprained your sacroiliac joint, I'm going to show you exactly how that occurs, what you can do to prevent it, and how to deal with it. And my name is Dr. Story. I've been a chiropractor for over 25 years. I'm going to give you some realistic advice based on my experience. This was a question that someone asked recently at Patreon. And by the way, before I show this to you, if you like these videos, give me a thumbs up, subscribe to the channel. Don't give me a thumbs down. I'm giving you all the secrets here. Become a Patreon. If you become a Patreon and you have a specific question, I'm going to make a video just for you. So what are we talking about when we talk about the sacroiliac joints? Let me show you. Right here is a chart that I use. So there's these two dimples that you'll see on the back of someone's butt. And that's actually an area where the ligaments are of the sacroiliac joint. Now, a sacroiliac joint is an area, and I'm going to show you on a plastic model here. This is just someone's spine, and that's their head, and this would be their left butt cheek, and this would be their right butt cheek. And the sacroiliac joint is the area where the pelvis meets the sacrum. The sacrum is this triangle-shaped bone right here. And the triangle-shaped bone is called the sacrum. This part here is called the ilium, and that's why they call it a sacroiliac joint. Now, what holds the sacroiliac joint together? Ligaments. Ligaments are like rubber bands that actually will hold bones together. It's not a muscle, it's a ligament. And what happens is when the bone actually moves, and there's very subtle movements when a sacroiliac joint moves, the ligaments will stretch slightly, and the natural elasticity of the ligament will allow the joint to come back. And as long as you don't overstrain the motion of the sacroiliac joint, these ligaments will stay healthy. Now, if you overextend what the joint normally wants to actually move, then if you stretch the ligaments too far, then you can actually damage the structure of the ligament, and then it won't have that elasticity anymore. It won't snap back, and then you'll get kind of a catching of the sacroiliac joint. Now, I'm going to put a link down below in the description, or I might put it as an end page. You'll find out at the end of the video, of visually seeing me analyze the sacroiliac joint. So when I analyze the sacroiliac joint, I can't put my thumbs on those dimples and watch a person walk. That's too difficult. You'd get dizzy just walking around doing that. The other thing is I can't put my thumbs on those dimples to analyze the motion when a person does, for example, lunges, because it's just too difficult. The easiest way to do it would be to mimic gait. So you'll see me have the patient hold on to a doorknob, and what they'll do is they'll raise their one leg and then they'll raise the other. Now what this does, if you think about it, is it mimics the actual movement of the sacroiliac joint. So when you actually, for example, walk or lunge, let's say you're going to lunge with the right leg forward, your right sacroiliac joint flexes in this direction, but when you lunge with the right leg, technically the left leg is going backwards. So in that particular case, then the left sacroiliac joint extends. So what that means is, if you imagine your butt cheeks right here and your sacroiliac joints like this, these are my thumbs, when the right leg goes forward and the left leg goes back, your sacroiliac joint does this. When your left leg goes forward and your right leg goes back, your sacroiliac joints kind of do this. So when you walk, you get this twisting motion, and that's normal. That's what you want to occur. If you sprain the ligaments of the sacroiliac joint, then you're going to lose on one side some of that natural motion. Very often an inflammatory situation occurs where it gets inflamed, and then that inflammation will cause a healing response where over time your body will form scar tissue and it'll become stiffer. But in the meantime, it actually will lock up, and that's what causes the locking pain. That's why a person has such difficult times moving. So here's the way I want you to think about it. I want you to think about a sacroiliac joint sprain as very similar to how you deal with an ankle sprain. Physiologically, that's what's actually happening. The sacroiliac joint is literally no different than a simple ankle sprain. And again, how does it occur? Well, in your particular case, if you were doing lunges, my guess is you were lunging far enough that it was straining the sacroiliac joint. So your sacroiliac joints will move in a certain way, in a certain range of motion, and it's possible you were simply overextending what your joints could allow. Let me show you. So if you do a long lunge, or a lunge that doesn't seem like it's too long, but it's too long for your sacroiliac joints, then what you're doing is you're overextending what you can do. My recommendation is, when this actually gets better, to actually do a shorter range of motion. Now, personally, I have found that when you lunge forward, it's a lot of strain on your knees as well as the sacroiliac joints. When you step backwards, that seems to be an easier type of lunge. And actually, people are less inclined to overextend themselves. So if you notice, when I'm doing the lunges properly by stepping backwards, you can hold weights, but the thing is that you'll notice that my lunge is such that the top knee, or the front knee, that the one I'm primarily working, is at 90 degrees. I'm not extending my knee past my toes. I am not extending too far forward. The back leg looks like it's also 90 degrees. Now, here's the problem. If you're young, you can get away with more. And unfortunately, the problem is the sacroiliac joints do lose mobility as we get older. And that's a natural response to the ligaments. You don't want to be stretching ligaments. So we have to respect our body and allow exercise to occur within the natural range of motion that our bodies are allowed to have for our age. So what this means is, as we get older, when we're doing exercises, you don't want to overextend too far. So if you notice, when I was doing the lunge properly, my back leg wasn't going that far, and thus you don't get that rotation that much, and that's how you prevent spraining sacroiliac joints. Now, the last thing is, as far as pull-ups are concerned, I don't think I've ever seen a patient sprain a sacroiliac joint through a pull-up. Even though the latissimus dorsi is connected to the pelvis, it just hasn't happened. So pull-ups, great exercise, and I don't think they're gonna hurt a sacroiliac joint. So keep doing those. Now, another thing that you can do to relieve the pressure on the ligaments of your sacroiliac joint is, you don't want to keep stretching them. And one of the ways to take pressure off the ligaments is to approximate or bring together the two ends where the ligaments connect. And one of the ways to do that is to sit in a chair the old-fashioned way. Now let me show you. So this is not politically correct, but the way to do it is to spread your legs apart. And you know how we used to sit in a chair like this? Well, this is actually very beneficial for sacroiliac joint pain. I actually show this to people who sprain their sacroiliac joints, and they're just amazed at what kind of relief you get from when they're sitting. Obviously, you're not going to sit this way in public. Well, maybe you can. Depends on where you're from. Who cares? The pain is less. You could lie down on your back and actually assume that same position. Don't do that in public. So hopefully this gives you the answer that you were looking for. Unfortunately, sometimes the answer is not what we're looking for. We don't want to hear that it's a sprain, and we don't want to hear that it's going to take time. If you can find an excellent chiropractor in your area, very often they can assist you in the exercise that I just mentioned. They can explain the physiology behind why this occurs. Sometimes when the joint gets locked up, a good chiropractic adjustment to the sacroiliac joints can do absolute wonders. You want to go to someone good, obviously, that's not just going to be doing the entire spine. You want someone that focuses on your problem and how to fix your problem. If you're having trouble finding a chiropractor in your area, then I'm going to put a link down below on this side of how I personally would find a chiropractor. And lastly, if you're watching this channel for the first time, hit subscribe. I do appreciate it.